Okay, Hannah. All right, a 68-year-old African American female having bad side effects from taking metformin. Is there a healthier alternative? Well, let's look at the metformin dose. Metformin is the number one most prescribed medication for diabetes. It works. It works wonderfully. It is inexpensive. The problem is that a lot of doctors don't prescribe it in a way that it is benign. The dosing schedule can be anywhere from 1,000 milligrams to 4,000 milligrams, and it comes in 500 milligrams, 750 milligrams, 850 milligrams, and 1,000 milligram tablets. If you take more than 1,000 milligrams, I virtually guarantee you're going to have GI side effects. Those side effects being abdominal pain, cramping, spasms, explosive diarrhea. So, but if you take it in the European model, which is the only way Dr. Collier prescribes metformin, the dose is 500 milligrams, which rarely bothers anyone. And I spread that amongst each meal. So instead of 2,000 milligrams with dinner, I give you 500 milligrams, one with breakfast, one with lunch, and one with dinner, for a total dose of 1,500 milligrams that I rarely exceed. And you get great response to that. Now, the other thing is metformin comes in two types. One is the IR formulation. IR means immediate release. This is the one that causes GI upset most commonly. They have extended release formulations that are timed and don't bother the stomach because they dissolve slowly into the GI tract. So ask for a 500 milligram tablet be taken 3 times per day. Ask for the extended release formulation, the XR formulation versus the IR formulation, and then also take the medication mid-meal, which means you start eating, you take the pill, you finish eating. When you take the pill, you also take, and this is any medication. Anyone listening to Dr. Collier, you know that one of my pet peeves is inappropriate dosing of medication and inappropriate taking of medication. 1 second. That being, oftentimes people will do what I just did. You take a pill, you take a sip of water, you take another sip of water, and then that's it. When you take a medicine, you need to take a full glass of water that melts the tablet, gets it out of your stomach and into your system in as little as 2 minutes. But when you just take a sip of water, that tablet starts to dissolve. It dissolves slowly. It turns into a gum. It sits on your stomach for hours and it causes GI upset because your stomach tries to continuously digest that medicine. So it keeps dumping more acid and more acid and more acid in an attempt to digest it. When the problem is really you just need to dissolve it with enough water. So you can take the pill mid-meal, start eating, take the pill, full glass of water, finish eating. Those things will probably resolve your quote bad side effects from the metformin, and you should do fine with it. If you do all of that and you just still have problems with it, then you need to there are 15 other medications that you can take that will not have those side effects and that will be good for you. But once again, I like the metformin. I use it. Metformin has an additional benefit that you may not be aware of. They utilize metformin in anti-aging clinics because metformin slows the aging process in your body on a cellular level. So it literally is anti-aging. So people who aren't diabetic take metformin so they'll look younger, feel younger, and live longer. So there are great benefits to taking it as well as treating and lowering your blood sugar and lowering your hemoglobin A1C. There you go, Hannah. Great question.